In this lecture, we are going to discuss anthelmintic drug, that is Pyrantel Pamoate. The most important thing regarding this drug is that it actually paralyzes the worms that are present in the gut of the, specifically intestine of the human. So, three most important worms affected by this Pyrantel Pamoate. First one is the pinworm, also known as Enterobius vermicularis. Second is the roundworm, and in that case you will see Ascaris lumbricoid. And third is the hookworm. In that case you will see the Necator americanus. So these worms lie in the intestine of the human body. Now we have to remove these worms by taking this drug. So this drug actually paralyzes the worms. We will see how. So first of all, we will see the normal mechanism, then we will see how this drug paralyze the worms. First, you will see at the end of the neurons, you will see the release of the neurotransmitter, that is acetylcholine. Now, this acetylcholine binds to the receptor that are present on the muscle, and these receptors are nicotinic receptors. These acetylcholines binds to the nicotinic receptor, and you will see the depolarization starts in the muscles. But when someone take the Pyrantel Pamoate, these drugs enter in the body of the worm, and after that it will increase the release of the acetylcholines at the end of the neuron, because neurons present in the worms as well. So acetylcholine, release of the acetylcholine start increasing, and you will see the when you will see lot of acetylcholine in the synapse, you will see the more binding with the receptor. So you will see the depolarization maintain for a long time. Similarly, an enzyme, that is cholinesterase, breaks these acetylcholine when the function of the acetylcholine finish. But Pyrantel Pamoate also inhibit this enzyme. When this enzyme is inhibited, then you will see acetylcholine breakdown will also be stopped in that case, and acetylcholine will remain in the synapses and bind to the receptor, and depolarization uh, maintains in the muscles, and as a result you will see the muscles contraction. And now this type you will see the paralysis. This type of paralysis is called the spastic paralysis. Spastic paralysis. Now the muscles of the worm will remain contracted for a long time, and ultimately the grip of the worm on the intestine of the human body will lose, and ultimately the worms can expel through the stool easily. So this is how Pyrantel Pamoate paralyze the worms by increasing the release of acetylcholine, by blocking the cholinesterase enzyme, and ultimately the grip on the wall of the small intestine will lose by the by the worms, and the worms can easily be expelled through the feces. Uh, this is how Pyrantel Pamoate acts on the worms. So adverse effects of the Pyrantel Pamoate, that will be related to the gut, nausea, vomiting, diarrhea, and the abdominal cramps can be seen by taking the Pyrantel Pamoate. So we will see first scenario: a school going child from a rural area has abdominal pain and passage of the long worms in the stool. Microscopy confirm Ascaris lumbricoides because it's a large worm that can be seen with the naked eye. So what will be the treatment in that case? We can give the Pyrantel Pamoate because it's an antihelminthic drug that can be used for the Ascaris lumbricoid as well. Second is the second scenario, a child treated for pinworm passes live paralyzed worms in the stool after medication. So most important anti-helminthic drugs that paralyze the worm is the Pyrantel Pamoate. So what type of paralysis? So you will see spastic paralysis happens in the body of the worms, and we can easily get rid of these worms. So this is all about the Pyrantel Pamoate. If you still have any question, you may ask in the comment section. Thank you so much.